Hi, I'm Dr. Mark Rothermich, orthopedic surgeon at Andrews Sports Medicine and Orthopaedic Center in Birmingham, Alabama. I treat patients at our Cullman, Trussville, and Winfield locations, as well as at St. Vincent's, Birmingham. I'm a general orthopedic surgeon with sports medicine fellowship training, so I treat sports injuries of the shoulder, elbow, and knee, as well as knee replacements for arthritis. I see patients in clinic with a variety of sports-related injuries, including rotator cuff tears, labral tears of the shoulder, as well as throwing injuries in upper extremity, in the elbow from overhead athletes. In the knee, I see both patients with acute athletic injuries like ACL tears and meniscus tears, as well as chronic degenerative conditions like arthritis. I knew at an early age I wanted to be involved in sports medicine. As an avid athlete and fan of athletics, I've always enjoyed watching sports, participating in sports, and being around active individuals. I like the idea of treating patients who are active and ready to get back to daily functional activities as well as sports. I grew up outside St. Charles, Missouri, which is a suburb of St. Louis. I went to Notre Dame for college. There, just randomly, I was assigned to a dorm room that happened to be down the hall from Michael Ryan, who's one of our surgeons here as well. He's part of the hip center and he's our hip preservation specialist. So we happened to just become friends when we were 18, freshman year in college, and went through 4 years at Notre Dame. From there, I went to medical school at the University of Virginia in Charlottesville, Virginia. Had 4 great years in Central Virginia, and then returned to St. Louis for my orthopedic residency at Barnes-Jewish Hospital at Washington University School of Medicine. I did 5 years of general orthopedic surgery training there, and then was fortunate enough to match for my sports medicine fellowship right here at Andrews Sports Medicine and Orthopedic Center and the American Sports Medicine Institute here in Birmingham. My wife and I went to high school together. So when we got to Birmingham for fellowship, we had never been here before, and it didn't take long before we realized that this is where we wanted to stay, this is where we wanted to raise our kids, and where we wanted to live. So the way things worked out after fellowship, we went down to South Florida for a couple of years, and we're so happy to get back. She's excited to be working at CBS 42 Morning News with Art Franklin. She's the morning news anchor with Art in the mornings on CBS here in town. So it's a great way for both of us to be able to invest in the local community being back now. I'm a big believer in having the patients have an impactful part of the decision-making process. I think the nature of paternalistic medicine is a thing of the past, where I, as the physician, tell you what should be done. I like the idea of laying out different options to discuss with the patient and have them come to the conclusion of how they want their care to go from a variety of different options that we discussed, both non-surgically and surgically. There's a lot of conditions that we see in the clinic that can be treated without surgery, conservatively, with physical therapy, injections, rehabilitation. When it comes time for surgery, I like to make sure the patient has a real understanding of the technical aspects of the surgery, of exactly what will happen and what their rehabilitation would look like.